I have one more question for you, and this one is specific to pharma. You've spoken about how changes that have been made during the pandemic to ease patient access to treatment, increasing the need for vigilance to prevent misuse or abuse. When there's no longer a need for that, hopefully, we're no longer a need for that level of loosening of controls. What are the lessons that we've been learning now that will carry through in terms of outreach and education to providers as well as patients?
Yeah, thanks, Michelle. So while there's really no longer, like you stated, that need for that level of loosening of controls, there are some very important lessons that we've learned along the way, lessons that will continue to inform us and help us to further improve the way we engage with our injured worker patient population. It's important to continue to work with injured workers through the opioid crisis that does still exist post-pandemic. Education and outreach will continue to be essential. Our injured worker patients, they want access to trusted information. They want to know what to expect from their treatment regimen. And knowledgeable patients, as we all know, are much more empowered to help guide their own care. When patients are more knowledgeable about their care and their treatment, they become more confident and they're able to take ownership of any challenges or barriers that may come up. Things including, but definitely not limited to, depression or transportation or the complexity of their medication regimen. All things that we've uncovered by engaging with our injured worker patient population. When we reach out to patients and demonstrate empathy, we can create a dialogue, which really can help all of us enormously as we are identifying any potential medication errors or any issues regarding their treatment regimen. In our fragmented healthcare system, the patient is sometimes the only person who has all of the necessary information. So why leave them out? As we learned in a recent study that included interviews with injured workers, patients sometimes feel they're being overprescribed medications or the wrong medications. That's pretty significant. By reaching out and listening to our injured workers, providing very much needed education and counseling, as well as collaborating with their prescribers, we really can improve medication safety and overall care coordination, which is very important to workers' compensation and healthcare overall.
Thank you so much for your responses. I appreciate that in particular. I know the opioid crisis is still a big challenge for the industry. Thank you for sharing your insights today. I think we've done a pretty good job going deeper into some of the issues surrounding empathy and engagement, and I'm sure we'll be talking again soon.
Appreciate your time. Thanks very much, Michelle.